Hey, what's going on? It's Dr. Pierre, your favorite board certified internist, founder of drbarrypierre.com, as well as the host of Dr. Pierre TV, your favorite YouTube channel to get all your health-related content, up-to-date information on public health news source that's going to be factual, truthful, and obviously easy for you to understand to help empower yourself for better health. This week, we're going to talk about COVID-19. I know as long as you've been watching TV, you probably heard about this topic ad nauseum, right? But unfortunately, we kind of always have to kind of keep you updated. I think the last time, we talked about it on this channel, we were talking about when President Trump, former President Trump, got COVID-19, right? So I'm going to give a quick little update on what's going on right now as far as what's been happening, right? And I always like to start my COVID-19 updates with a thing. But before we start, remember to like, subscribe, hit that notification button so you're always aware of what's going on here on Dr. Pierre TV. So first and foremost, all right, so we're going to go on just some quick numbers, right? Because I think a lot of times you hear COVID-19 so much, you hear coronavirus so much that you don't really understand really the impact, right? And I know I have worldwide listeners, but I do like to focus on the numbers here in the United States first, and then I'll drop the worldwide numbers as well. So as we speak, as I'm recording this, we have 27 million people currently affected, currently diagnosed, or have been diagnosed with coronavirus. We have 462,000 deaths, right? And again, it's such a sobering, fact to, unfortunately have to relate. 462,000 deaths. And remember, our first reported cases was in February of last year, right? So in 1 year, we've lost 462,000 people. And then I just want to give, because I know I'm going to have people asking about the worldwide numbers. Worldwide, there's 106 million cases with 2.31 million deaths, right? So again, United States definitely not doing a great job, and as you can see, because this is a pandemic, it is clearly affecting the worldwide stage. And again, of course, we're at 27 million, we're the number one country across the board. The second runner up per se is India with about 10.8 million cases and 155,000 deaths, right? Just to kind of give you an idea of a job that we're doing or not doing. So that being said, of course, wear your mask, social distance. I know it's possible. I know by the time I'm recording this, Super Bowl Sunday's coming around, and Super Bowl parties may be around, and I want you to kind of be safe and be careful, right? Because again, I don't want you to enjoy a great night of celebration and in 2 to 3 weeks talking about I'm sick, or my family members are sick, or even worse, right? Because you wanted to enjoy that one night of celebration, right? Again, wear your mask, wash your hands as much as possible. But most importantly, when you have that opportunity, get said vaccine, right? Again, if you've been following my journey, you know that I've already, gotten my second dose of the Moderna vaccine. It is one of the two vaccine doses that are have emergency use at this moment. And I wanted to kind of give an update on just kind of the different vaccine types that we have out, at least at the moment. We have a couple more, but at least the 4 that you may have heard of or may have gotten a wind of across the country, depending on where you're watching this, right? So I do want to, let me show this here. All right. So what you're looking here is the key features of the COVID-19 vaccine frontrunners, right? And I apologize, I don't know which article I got this graphic from. It's actually a great graphic. So if you happen to know which article I got it from, please drop it in the comments below so I can give that, that person or whoever did this graphic their proper due and credit. So 2 vaccines on the right, as you can see. And again, like I said, you don't have to understand the scientific technobabble. I am here to break that down for you. Type of vaccines right now, the top 4 front runners that we have are Moderna, Pfizer, AstraZeneca, Johnson & Johnson. So you see on the type of vaccines, you have mRNA versus the non-replicating adenoviruses. So I know I've gotten a lot of concern from a lot of the guests that either watch my videos, listen to the podcast, read the blogs, or hear me speak live somewhere talking about this concern for mRNA vaccines. And again, they're not new vaccines, despite what you may think. They've been around for at least 2 to 3 decades, right? We just had the unfortunately the perfect storm that allowed us to kind of brew them up and get them into production as fast as we want to, as well as the typical non-replicating adenoviruses for the AstraZeneca and Johnson & Johnson. And then again, just kind of going, because people want to know what the differences are. 2 doses versus 1. Now the Johnson & Johnson is the only vaccine, at least out of this 4, that is a 1 single time dose, right? I think that's going to be very important. Antibody detection. You see the Pfizer, after 7 days of the booster, you can get antibody protection, whereas Moderna, it's about 14 days, and then the rest of them are also 14 days. So Pfizer, 7 days, like essentially 1 week after you get your second dose, you already start having antibodies. You already be ready to be protected. Now you see this efficacy number here. And you can see the graphics is a little bit old because we actually have numbers for Johnson & Johnson. The efficacy for Pfizer about 95%. Same thing about for Moderna. AstraZeneca does drop a little bit to about 70%, and then we know that the efficacy for Johnson & Johnson is about 66%, right, as far as the incidence of picking up said disease. But most importantly, right, and I think one thing we want to stress, especially when we're going to talk a little bit about Johnson & Johnson today, the efficacy of preventing a person from having severe related disease from COVID-19, their numbers are actually up to 85%. So I don't want people to look at especially this efficacy line and thinking like, well, the first 2 are in the 90s and the other ones are below 90, so the other ones are not that good. No, that is incorrect. There are different populations that were studied, different parts of the country that were studied, and then just again, the different types of vaccine that they are kind of lead to that level of difference as far as efficacy concerned. And then this is something that, again, you guys don't have to think about, right? But the storage requirement, right? One of the biggest knocks or concerns for Moderna and Pfizer was the fact that you had to have essentially like super deep freezers just to be able to hold that vaccine. And then, if they got out, because I'm pretty sure you've seen some of the articles where someone left, the vaccine out, or I even read an article where an employee actually took it out on purpose, right? They actually got fired, and I think they went to jail for like a felony damage. But again, that's one of the things that happened. Whereas here, this is essentially like just room temperature, right? So this is going to be very important. The AstraZeneca and Johnson & Johnson, especially when we think about other countries, maybe outside of the US, right, where there's not a whole bunch of deep freezers sitting around in every parts of the country, right? You may have parts of the country, which you do, right, that don't have the capacity to hold, right, a vaccine under negative 70 degrees Celsius. I want you to think about that, how cold that is, negative 70 degrees Celsius, just to hold this said vaccine, right? But over here, 2 to 8 degrees Celsius, right, much more manageable, especially when we talk about across the country. And then again, they talked about the kind of the shelf life. You see here these ones that are under the cold temperatures, 5 days and 30 days, right, which is not that long, versus 180 days, right? So again, so much more opportunity with these 2 leading viruses here, AstraZeneca and Johnson & Johnson. And then kind of talked about the numbers games as far as who is looked after. Pfizer looked at from age 16 to 85. Moderna looked at from 18 and above. And the same thing for AstraZeneca and Johnson & Johnson, right? So again, we don't have studies for kids, because I get this question a lot. We don't have studies for kids yet. I'm almost sure that at least as I speak, they're currently working on getting these studies down, but at the moment we don't have these studies. So for those who may be thinking, all right, so what vaccine am I going to be able to get, right? So right now, as I speak, as I record this, there's only 2 vaccines available for emergency use authorization. And what does emergency use authorization mean? That means that the government says, you know what, based on the numbers that you're giving us right now, we're okay allowing you to give it to the general public. That does not mean the studies are not finished, right? Because the studies aren't. The studies are still going. They're still likely to be going for a couple of years. But that does mean that the numbers are looking so good now that we're okay with you giving it before the study finishes, because we're not expecting any adverse, turn of events later on, right? Which again, I want people to think about, because I got in this question a lot too. Well, what does emergency authorization use means? That like essentially what that means. The studies are still going, but the safety numbers look so great that they're okay giving it out early. And now the newest player that would be added on, we're hoping within the next month or 2, is Johnson & Johnson. And I want to highlight that here. All right, so as you can see, Johnson & Johnson asked for FDA approval to authorize its COVID-19 vaccine. Again, this will be the 3rd vaccine player, and we know some of the issues or concerns that we're having with Moderna, just as far as storage, as far as getting get to the people, Johnson & Johnson would be extremely beneficial. But what was interesting, right? And they came out with their numbers, and again, I'm gonna have a link to their actual report for their numbers as well to kind of discuss the differences, and just so you guys can kind of understand. Like I said, I want to make sure you guys are fully prepared and understand what's going on, right? Because again, I am a proponent of the vaccine, obviously, since I took it, right? And I want everyone to be protected, right? Because again, 27,462,000 dead from this virus, right? So this is not a virus that's going anywhere anytime soon. So here we see here, and again, I just want you to kind of highlight this initial paragraph. Vaccine candidates 72% effective in the U.S. and 66% effective overall, preventing moderate to severe COVID-19 28 days after vaccination. So we talked about the efficacy on that last graphic, right, where like Pfizer, Moderna, you had 7 days, you had 14 days as far as antibody protection. Here, 85% effective overall in preventing severe disease and demonstrating complete protection against COVID-19 related hospitalization and death. I think that is extremely important, guys. Again, 85% chance of not having to go to the hospital, 85% chance of not having severe hospitalization, because if you get this vaccine, right, this is going to be a huge player. And again, I can't wait. I know it's going to get authorization. I just can't wait until it gets authorization, because I think that's going to open up the pool to allow more people to get it. And the reason why more people need to get it is because if we don't get a significant amount of people who get said vaccine, who get protected, and a question I always get, if I've already gotten coronavirus, let's say I got diagnosed 3 months ago, 6 months ago, am I protected? The studies have already shown that that is not the case. The studies shown that those who pick up the virus, right, incidentally or however they pick it up, even if they do well from it, right, they're not protected 3 to 6 months later. So this is going to be a game changer, right, as far as these vaccines are concerned, because we know the protection is going to be long win. Now, if you ask me, I fully expect that, just like the flu, the coronavirus vaccine is something that we're likely going to have to be taking on a year-to-year basis. Again, I'm just shooting out theories there. I don't know, right? So I don't want you to say Dr. Pierre said that all of a sudden we're gonna have to take this every year. I don't know, but my concern and my thought process is that I could see something like that happening. Maybe not every year, maybe every couple of years, to protect yourself and really to protect everyone else. Because remember, when we get the vaccine, not only are we protecting ourselves, but we're trying to protect everybody else around us. Again, I want you to enjoy your Super Bowl Sundays, right? I want you to enjoy your Thanksgiving dinners, right? I want you to enjoy your Christmas, get-togethers, right? I want you to enjoy vacationing again, but I want you to do it safely. And then I know I can't, actively promote doing those safely unless I know we have a good amount of our population taken care of and ready to go. So if you ask me, right, what is the next game plan? I think this is going to be a big player. Again, the general public, because this is a question I always get, when am I going to get the vaccine? Me being a healthcare professional, of course, I'm the first in line. Again, I take care of patients every single day with coronavirus, face to face. I'm talking to them. I'm talking to their families, right? So that's, of course, I'm going to be on top of the line, right? But you're asking the general public always ask me, when am I going to get my shot at the vaccine? And honestly, that's a very important question. But honestly, the question I always say is, I don't know. The reason why I don't know is because it's very state specific. One website that I've recommended throughout this whole process when we talked about the coronavirus is the CDC. Please check the CDC. Please check your state's government's health department websites as well too, to understand when you may be in line, right? I know in Florida, not only healthcare workers, but those age 65 and above have been phased in, and those with high risk disease, autoimmune related disease, have been phased in to be able to start getting the vaccine, right? But I'm not sure when the general public is just going to be able to go to all of these grocery stores, these pharmacies, and get them themselves. That I'm not sure, at least at this moment. So please check with your state to know when is it going to be your chance, right, to get the vaccine. So I am yours truly, again, Dr. Pierre. Again, I thank you for joining. Thank you for, again, liking, subscribing, hitting the notification bell on this channel. You guys have been amazing. I'm here for you guys. Any questions, any concerns, please drop it in the comments. I again, it's not like a random robot. I will be the person answering those questions that you have in the comments if you have any questions. And if you want to hear any topics, because again, we are going to be, like I said, obviously coronavirus is the flavor of the month, but we're going to be talking talking about a lot more different topics on this channel. So if there's a topic that you know you want to hear from, just let me know and I'll make sure I make that happen. So you guys be blessed. Have a great day. Stay safe. Wear your mask, social distance, and when it's your time, get the vaccine.